Hello, my name is Gina, and today I'll be presenting on breastfeeding and maternal outcomes. There are benefits of breastfeeding for the baby, the mother, and the community. This presentation will focus on the various benefits of breastfeeding for the mother. Individuals who breastfeed are at a decreased risk of breast cancer, ovarian cancer, and type 2 diabetes, as well as other health issues that will be discussed later on in this presentation. However, the rate of breastfeeding in the United States is not meeting the goals set forth by the U.S. Department of Health and Human Services. My research question for this project was, what effect does breastfeeding have on maternal health? Thus, the goal of my research project was to identify the short-term and long-term impacts of breastfeeding on maternal health outcomes. So this is an important topic to research and further understand. Breast milk is the natural first food for newborns. It provides energy and nutrients that an infant needs for development. For mothers who breastfeed, compared to those who do not, breastfeeding has been reported to lower risk of breast and ovarian carcinoma, decrease blood pressure, and lower the risk of type 2 diabetes. The World Health Organization recommends exclusive breastfeeding in the first 6 months and continuation of breastfeeding for up to 2 years and beyond. It is well established that breastfeeding is beneficial for the mother, baby, and society. However, the proportion of mothers breastfeeding in the United States is disappointing. Recognizing the importance of breastfeeding, the U.S. Department of Health and Human Services sets forth national breastfeeding objectives for women every decade. So how did I go about answering my research question? I conducted a literature search through various databases such as PubMed and Medline. A total of 16 sources were used for this project. 5 were systemic reviews, 8 were research articles, 2 were newspaper articles, and 1 was a government report. Various keywords were utilized when searching for relevant sources of information, such as maternal breastfeeding outcomes, breastfeeding benefits for mother, breastfeeding disparities, and maternal breastfeeding interventions. The sources I used found that there are disparities among racial and ethnic groups in terms of breastfeeding rates, which in turn impacts maternal health benefits. Based on the table, a majority of racial and ethnic groups are not meeting the goals set forth by the Centers for Disease Control and Prevention. The only group meeting the goal of breastfeeding initiation is Asian women. Yet no group is meeting the goal of breastfeeding continuation at 6 months and 12 months. The lowest rate of breastfeeding initiation, as well as the continuation of breastfeeding at 6 months and 12 months, is found among African American women. Breastfeeding is beneficial to almost all mothers and infants, but the benefits may be significantly greater for minority women. Minority women are disproportionately affected by adverse health outcomes, which may improve with breastfeeding. It's important to understand the health disparities surrounding breastfeeding, as the racial and ethnic groups with the lowest rates can be prioritized for interventions that are aimed at increasing rates of breastfeeding. While completing research, many of the sources focused on the reduction in risk that breastfeeding provides for breast and ovarian carcinoma and type 2 diabetes. It was found that the more time spent breastfeeding had a 32% reduction in type 2 diabetes. And in addition, breastfeeding leads to a 22% decrease in the risk of breast carcinoma and a 30% reduction in the risk of ovarian carcinoma when compared to individuals that never breastfed. Additional findings discuss the role of breastfeeding on hypertension, mental health, privacy, and previous experience. It was found that breastfeeding decreases blood pressure, specifically systolic blood pressure. Thus, the longer one lactates, the lower the odds of hypertension and the lower incidence of metabolic syndrome. In terms of mental health, there is an association between breastfeeding and depression during both the prenatal and postpartum periods. Symptoms of depression, both during pregnancy and postpartum, may cause the termination of breastfeeding. But on the other hand, adverse experiences with breastfeeding may lead to depressive symptoms. It was also found that there was a positive relationship between previous breastfeeding experiences followed by the initiation or duration of breastfeeding. So, for example, if a mother had negative breastfeeding experience and a short breastfeeding duration in the past, it was more likely for her to have adverse breastfeeding duration in the present day. Lastly, findings show that privacy and safety concerns about breastfeeding increased from delivery to a month postpartum. These results demonstrate that breastfeeding rates are geographically distributed. Breastfeeding is a public health issue. Breastfeeding interventions can be completed at various levels, such as at the individual, organizational, or public policy level. Interventions at the societal level can focus on larger issues such as culture and stigma to help encourage breastfeeding. An example of a multi component intervention at the societal level could include media campaigns, support groups, and the training of health professionals. At the policy level, those working in the public health field can write healthcare standards that can be put into place at the local, state, and national level. Policies and other interventions can prioritize populations with the lowest rates of breastfeeding, such as African Americans. Also, as mentioned previously, breastfeeding rates are geographically distributed. If a mother is concerned about their privacy and safety, they breastfeed less. Public health interventions can ensure that there are safe spaces for breastfeeding. It is essential that health professionals gain knowledge about breastfeeding so mothers can be properly informed. Yet there are few opportunities for future physicians and nurses to obtain education and training on breastfeeding. Thus, public health interventions can create further educational opportunities for health professionals. Education of healthcare providers is associated with increased rates of breastfeeding, higher levels of maternal satisfaction, and a higher level of professional knowledge and skills. In terms of clinical implications, the changing of health professionals' attitudes and beliefs is required to promote breastfeeding. Interventions by health professionals are needed to increase breastfeeding rates. The education of health professionals is the first step. When health professionals are educated and trained, they're able to administer education and provide support to mothers. Health professionals are also needed to refer patients to available community resources, such as lactation consultants. Some health professionals may have a greater impact on breastfeeding rates, such as obstetrician gynecologists and internists. Internists can be helpful as they care for women after birth, but more research can be done into the role of the internist as an advocate for breastfeeding. Also, scientific studies can be used to determine effective interventions. For example, an intervention that provides routine obstetric care and follow up, as well as face to face individualized sessions and individual consulting by phone, may be appropriate for clinical use to promote breastfeeding. In terms of practical implications, there are many things that we can do as health professionals. A majority of doctors are not telling women about breastfeeding and how it is beneficial for both the mother and the baby. And an individual is more likely to breastfeed when they're aware of the health benefits. This lack of education and awareness are significant factors impacting the rate of breastfeeding. So, as health professionals, we need to make an extra effort to provide education to our patients and clients. Family support is also crucial to a successful breastfeeding experience, and African Americans are less likely to have a family history of breastfeeding. This is where health professionals can step in and provide support. Support groups and social media are other beneficial tools that can help spread education and awareness in order to end the stigma surrounding breastfeeding. These are my references, and that is the end of my presentation. Thank you for listening.